Do you frequently feel like your heart pains sometimes? Well, it might not be your heart. Sometimes, it's just how exhaustion feels when your body is fighting something big. What if I told you a virus could make you feel like you've run a marathon without moving at all? That's exactly what happens with infectious mononucleosis, or mono as most people call it. It's often nicknamed the kissing disease because it spreads through saliva. So, have you ever kissed someone and then felt super tired for weeks? Maybe it wasn't just love, it could have been mono. So what actually causes this? It's mainly a virus called Epstein-Barr, EBV. Think of it like a tiny burglar sneaking into your cells through saliva, maybe from a shared drink, toothbrush, or yes, even a kiss. Once it's inside, it starts multiplying in your throat and blood cells. Fun fact, over 90% of adults have had EBV by age 40, but not everyone gets sick. Kind of like how not every person who gets a computer virus actually sees problems. Some systems handle it quietly. But in teens and young adults, EBV often throws a full-blown party in the body, and that's when mono shows up. Ever felt so tired that getting out of bed felt like climbing a mountain? That's a classic mono symptom. But that's just the start. You may also have a sore throat that feels worse than a normal cold, like your throat is on fire every time you swallow. Lymph nodes in your neck and underarms might swell up. Try touching them. If they feel like little peas under the skin and hurt, that's a clue. Fever, headache, and even a rash, especially if someone wrongly prescribed amoxicillin, can show up too. Imagine being so wiped out that watching a 30-minute show feels like a workout. That's mono in real life. How do doctors know it's mono and not just a bad flu? They'll ask, have you been extremely tired lately? If yes, they might do a simple blood test. One common test checks for heterophil antibodies, special markers your body makes to fight EBV. There's also a specific EBV antibody test for tricky cases. No fancy machines or space tech, just a small blood draw. And the treatment, no antibiotics, they don't work on viruses. Instead, it's all about rest, fluids, think water, broths, smoothies, and letting your body heal itself. It's like letting your phone fully charge after it died. Rushing only breaks it more. In rare cases, if your spleen swells, doctors might tell you to avoid sports. Yes, no basketball or soccer for a while to prevent injury. Not 100%, but you can reduce the risk. Ask yourself, do you share drinks, utensils, or lip balm? If yes, that's a risk, stop sharing. It's simple, no sharing saliva. Washing hands helps too, even though EBV isn't mainly spread by touch. Think of it like not lending your toothbrush. Gross, right? But that's exactly what keeps EBV away. There's no vaccine yet, but staying aware helps. If a friend has mono, give hugs, but skip the shared milkshake. Recent research is uncovering more about EBV's long-term effects. Scientists now link EBV to diseases like multiple sclerosis, MS, which affects the nerves. They found that people who had mono are more likely to develop MS later. That's a big clue. Also, researchers are working on an EBV vaccine. Imagine one shot to block mono and maybe even MS. Trials are ongoing. Plus, new lab tests can detect EBV earlier and more accurately. So while we can't cure mono, yet science is getting closer. Every day